We will be talking on how to plan a pregnancy fast. Many patients do not even know when it is the most fertile for them to stay with each other to get a good pregnancy. How to know which days are fertile? Menstrual cycle days are 4 days in which you have your periods. Post menstruation also, you are not fertile as at that time the egg starts to form. It generally happens that on day 14 or around day 14 we ovulate, we produce egg. So day 10 to 18 is called the most fertile period, like 4 days prior to ovulation and 4 days after. Because egg will ovulate or come out of the ovary on around day 14. Sperm, if goes inside after a contact before that, will stay there generally for a period of 2 days. But even up to 5 days, it can stay in your vagina and cervical canal. And similarly, after ovulation, the life of ova is generally 1 day, but may even extend for 2 days. So after ovulation also, if the sperm reaches in 1 to 2 days, it can give you a pregnancy. So this is how we calculate when it is most fertile for you. The ovulation can happen from day 12 to day 16. So it is said that days 10 to day 18 is most fertile for you. Tracking the signs of ovulation can also help in finding out when the lady is fertile. It can help you decide when you are ovulating each month. Signs of ovulation include mild cramping in the lower abdomen because of release of fluid which is in the ova. You feel slightly wetter. There is clearer and more slippery vaginal discharge, similar to egg white. A small increase in basal body temperature also can be noted. But then basal body temperature is not a very good sign. There is also a higher sexual desire and drive. So these are the features. If you track, then you can find out when you are most fertile. For this reason, a person can, without going to a gynecologist or a lady doctor or a fertility specialist, for some months can try to become pregnant. It may be helpful for someone to track the signs over a few months to get an idea what is typical for their body. But if they are not finding it favorable or if they are not having a pregnancy, they should keep in the mind that these have several variables and the timing of ovulation can change month to month. So sometimes if this method is not helpful, we should not delay and we should consult a fertility specialist. Another option is also to use an ovulation predictor kit or fertility monitor. This can help sometimes. There are some devices also which identify the days of peak fertility. Using a combination of these can help in finding out when you are most fertile. But remember that if this doesn't help, you should not wait for a long time and for getting pregnant soon and before your ovarian reserve falls or there is some other problem, you should meet a fertility specialist. Thank you so much.